If we could end whatever individual conversations we're having, so we could get started on our presentation. There's a lot to cover. We'll try not to move too fast. This is a really a new concept, so we want you to get as much out of it as you can. I am Donald Whitehead. I am the Executive Director of the National Coalition for the Homeless, also the co-founder of Racial Equity Partners. That's a company that I started with Jeff Olivet, who is now the United States Interagency Council on Homelessness, who also has worked quite a bit with the healthcare for the homeless programs across the country. I've done so as well. So just a little bit about me. First of all, I have on a suit and a tie, but I'm we come from the same place. I'm a person with lived experience. I spent 5 years on the streets of Cincinnati, Ohio, and my first interaction with board and policy work came with the Cincinnati Health Network. I see my good friend Valerie back there. We've known each other for a very long time through that work. I've had the honor and the privilege of working with healthcare for the homeless programs since 1995. I've been a board member for the Baltimore Healthcare for the Homeless. I've also been a staff member for the Orlando Healthcare for the Homeless program, Orange Blossom Healthcare. At that program also provided direct service. I housed the 300 hardest to serve homeless individuals in Orlando. So my work has been, I've been doing this work again for, at this point, almost 30 years. Actually, before I started here, I worked for Greenpeace on environmental racism. So been doing work with poverty and homeless programs. Have worked at every level, worked as an outreach worker, worked as a program manager and executive director, and now I work in both advocacy and technical assistance. So one of the things that I learned through that work, and I will say my other presenter today is David Perry. Most of you know David Perry, NCAD member. I'll let him introduce himself and do his own bio. Our third presenter, Dr. Rajni Shankar Brown, who is a PhD at Stetson University and also someone with lived experience, is not able to be here today due to the incompetence of the airline industry, and some of you may have experienced that as well. So she won't be here today, so some of her stuff we'll have to skip because she has not provided us with context on it, so we'll have to rush through that. So one of the things I learned in my experience, I got to a boardroom as a member of a healthcare for the homeless program, and when I got there, and some of you may have had this experience yourselves, I had absolutely no idea what I was doing. So I would sit in those rooms and they would be going through financials and talking about programs and all these acronyms were going over my head. I had absolutely no idea what they were talking about. I was just happy because they had some coffee and donuts at the meeting. And so since that time, I've wanted to be able to resolve that, because when I have been on the other side as a board president or as a member of the board, I could see in the room people who were struggling just like I was. And so I think that it's so important, and for the last 5 years I've been on a crusade, if you will, to create a program that gives people the opportunity to be prepared when they sit down in that boardroom. And so we came up with something called the Lived Experience Training Academy. And in short, the goal of the Training Academy is to prepare people so that your input, because it is so valuable, we know that people closest to the problem have the most important and most relevant things to say about the solution. So people can talk theoretically about how you can get to a program and what resources are the best resources, but nobody can really tell people if it works unless they've actually gone through that process. And so we value lived experience, and a definition of lived experience is that lived experience is people who have been through an issue and bring that issue, versus learned experience where people are in a classroom and they get theory and they get education about an issue, but they do not have that experience. A true powerful combination is people who have both lived and learned experience. People who have that are dynamic, and I know some people in this room are in that position right now. I wanted to start first with, before I talk about LETA in specific terms, I also wanted to talk about the National Coalition for the Homeless. And some of the things we do, and some of you may want to, at a later date, be involved in some of that. So the National Coalition is the oldest advocacy group that works exclusively on behalf of people experiencing homelessness. So we've been around since the late 70s. And if you have been through a program that provides homeless services, the National Coalition is primarily responsible for that. The reason I say that is most of the programs that service people experiencing homelessness are a product of the McKinney-Vento program. Well, we wrote the McKinney-Vento program in our offices. And if you have been serviced by a program that's funded through the PATH program or grants that benefit homeless individuals, we also help produce those programs as well. So we have been around since really the start of modern homelessness. And I say modern homelessness because we've had 4 distinct periods of homelessness in our country, starting back in the colonial times. But what has happened at every point in that history along that timeline is the federal government has provided an influx of resources that provided a remedy for people and dramatically reduced homelessness. So we know that there were jobs programs, public housing programs, Social Security is another program by the federal government that greatly reduced homelessness. But this modern era that started in the mid to late 70s and is still going on now is the longest period of homelessness in our history. And it is the first time that we've not seen a robust federal response. The only response has been the McKinney-Vento program, which started out as a comprehensive solution, but actually ended up just being an emergency solution for homelessness. So we have a lot of work to do, and I'll stop on the federal government bashing for a minute. So our first principle of practice at NCH is that homeless and formerly homeless people should be involved at every level. And we not only say that in our mission, we actually live that. So 60% of our board and 90% of our staff are people with lived experience. Wow. So both the staff and the board, thank you, both the staff and the board play really critical roles in providing services. So we have programs that are really geared towards moving the needle on homeless service delivery and also providing resources for people that are homeless. So we have a speakers bureau. It used to be a DC-based speakers bureau, but now it's a national speakers bureau. So anyone in here who's had the experience of being homeless can be a part of that speakers bureau. All you have to do is contact our office. Typically there's a stipend of $100 every time you speak. And you speak all over the place from Capitol Hill to churches and civic organizations in your community. We also have a technical assistance project. So we do technical assistance with the state of California. I know we have people in the room who are part of that process. We also have a national technical assistance project with HUD, and that project actually pays people $150 an hour to help HUD shape programs. Again, we recruit people all the time. If you're interested, just contact our office. So we recently have taken a look at the AHAR, and that's the Annual Homeless Assessment Report. And with that report, we looked at it to make sure it had language that was the first person language. So we're not homeless people, we're people with a homeless experience. And so we want to make sure that agency that's primarily responsible for providing those services is speaking in that language as well. And we also have, in addition to those programs, we do political education. It's not lobbying. It's not lobbying. I have to say that a couple of times because you can get in trouble for that. We go on Capitol Hill. We just had a briefing this week. We brought in members of Congress from all over Congress to talk about homelessness. And then finally, we also do grassroots organizing. So we go into communities and help fight. Right now, there's 65 cities that have criminalization practices, including right here in the state of Tennessee, where it's now a potential felony if you're sleeping outside. So we're working to do something about that, a lot of work to do. So that's the National Coalition and me. And so we'll go to the next slide. So the LETA, again, LETA stands for the Lived Experience Training Academy. And these are the core components. Technology literacy, again, many people there's an expectation now, especially because of COVID, that everybody knows how to do Zoom or Teams or some of that stuff, or people even have the equipment to be able to do that. So one of the first things we talk about is helping people get to a level of competency with technology. We talk about wellness and self-care. A lot of us, and I'm included in this, we take care of the people we serve, or the people we connect with, or that board of directors, but we don't do as good a job of that when it comes to ourselves. So we work too many hours, we work too long, we don't spend enough time with our family, so we do a lot about that. We talk about the history of homelessness, because if you don't, George Santayana says, if we forget the past, we may in fact repeat it. So we talk about that history so people really understand it. We talk about communication on a lot of different levels, how to listen and how to speak in a way that you can get. One of the things that is really important here, sometimes we get pushed to the side or ignored because the anger, the pain of being homelessness comes out when we speak. The pain of being homeless. And sometimes people will write that off as angry people or people who are not to be listened to. But our communication track really talks about how you can say the same message with the same emotion, but do it in a way where people listen to you. And so it really talks about framing your messages in a way that's really effective. There's a financial literacy component. Most of us did not have financial literacy training in our traditional education. So most high schools, most colleges, some colleges, but most high schools don't give us financial literacy training, so we go back to that. And then we talk about organizing and advocacy. So those are some of the components. Now, this entire curriculum was actually designed by focus groups with people experiencing homelessness and a faculty that was all people experiencing homelessness. So this isn't providers or politicians telling us how we should do it. It's people who have been through the experience with it. Some interconnected things, and one that isn't listed here, I have to say, is we do everything that we're doing in this curriculum is also framing it around racial equity as well. So we want to make sure that we address that issue, but all of these other things are connected and woven through each of the topics. Transformative leadership, best practices for when you become a leader, legal connections, knowing the rights, trauma-informed care and healing, how to handle triggers. We know that when you start telling your story, sometimes you relive that trauma, so we talk about that. Public policy, some of the legislative issues that are out there, so you can be informed when you're talking about some of the things that are in place. Because it changes so often, it's really hard to keep up, so we try to make sure that you're in tune with everything that's going on. Key vocabulary. We talked about jargons, all the acronyms that are used, CDBG and EHV and all, it's really hard to keep up with no matter what level you work in this process. Extending learning resources, additional resources and tools that may be helpful, and self-care reminders and tips. Again, all these are woven through all of these modules. And the art of communications, language, and effective leadership. Now, this is one of the first modules. I actually have not been presented with the final module yet. So Rajni Shankar Brown was going to do this, but basically I'll try to do a quick overview of it, but I can't get into the details because Rajni created this. So the art, I should always say, is by Kieran Singh. So next slide, please. So here's a sample of some of the key concepts and terms that you would encounter in the communication module. The communication process, nonverbal communications, active listening, communications in the digital age, and essential leadership skills. That's all in the communication component. Now, it talks about the process of communications, and this is just an outline of the sender sending the message and all of the things that have to happen for that message to get communicated effectively to the receiver. And I won't go through this module again. This is a Rajni module, but there are all these, you see noises in the middle of that. So being able to hear a message that's sent to you without all the distractions is what this component talks about. The next would be nonverbal communications. We were going to do an exercise, but because I keep getting messages from David telling me I'm going too long, we're not going to do that exercise. This is a really easy exercise. It's really fun.
Right out there.
So it's a really fun exercise. We may, you can certainly do it in your own time, but it's really good making sure that you hear the message that you're getting. The next slide will also talk about kind of, as we communicate, there is verbal communications, but that's only a small portion of the actual communication process. A more substantial part of that process is nonverbal communications. And these are just some examples of how you communicate through nonverbal sources and how it's received. So your posture, your body language, your eye contact, blinking, tone of voice, facial expression, smell, time, personal presentation, and gestures. These are all types of nonverbal communication that, as they're received by a person, can change the content of the message totally. So if you're, and when I was talking about, when you're in front of a continuing care board or in front of your local elected officials, sometimes you can present a message that's not as welcoming because of all these nonverbal things that you present in that conversation. And sometimes, again, people will turn you off.
Automatically.
They don't even hear your message because of what you present non-verbally. Yeah. And so one of the modules is really to take a look at that. And then the other part of communication, and I know some of you have heard this many times before, is on our next slide, which is active listening skills. And asking open-ended questions, requesting clarification, being attentive, summarizing, paraphrasing, reflect feelings, being attuned to feelings, and asking probing questions. That lets the presenter know that you're actually actively listening to what they say. Because often what we do in communications, instead of listening to what's presented to us, we're thinking about what we're going to say next. And if we're thinking about what we're going to say next, it's very hard to receive that message that's being given to you. So again, this is an example of the kind of training that's in these modules to really help prepare you for next steps. And effective communications requires more than an exchange of information. When done right, communication fosters understanding, strengthens relationships, improves teamwork, and builds trust. There's also a really big component of this, which is about communications in a digital age. We're becoming more and more wed to, sometimes we're prisoners of technology. And if you want to exist in this world, you have to really start to learn that. I know a lot of people in my age group, I won't tell you what that is, a little bit resistant to technology. But it's really essential to, especially if you want to work in this field, you have to start to learn communications in the digital age. And You don't have to master it, but you have to have sort of a marginal ability to do that. And then we'll talk about leadership skills and all of the components of being a good leader. Some of you lead your in-cab in your community. So these are some traits that you really want to make sure that you incorporate into your leadership, and that's communication, motivation, positivity, creativity, and feedback. So all of those things are really, really important as leaders. Now this training has 9 modules. That's just a sample of one of them. Right. We wanted to give you a little taste of how this would go. It's a 6-week course. You'll get a certification at the end. We're working on right now the last pieces of this, and that's to make sure that people are able to get CEUs and that they're able to use this in their movement towards secondary education. So if you're working on your degree, we want this to be, because it's being developed by a professor who her PhD is in curriculum development, we think that that's not a hard task. So the last thing we have to do is the software, and our launch is this month. We're working out the final details. One of the things that we have to do is a pilot. And what I'm going to propose, David, this is breaking news, is that we do a pilot with the NCAB. So we're going to do a couple of pilots. We want to get you to take a look at this and get your feedback and see if it's really useful, because if it's not useful, we've wasted a lot of time. I've wasted 5 years of my life. We're going to talk about another component in just a second. David's going to come up. Another component of this was, again, your rights and understanding your rights. David Perry has been doing that work for a very long time. We'll take questions at the end and make sure that David gets the time to do his full presentation. And I'll answer any questions. And the last thing I'll say is we started this also with a peer support component. So peer support is so important. So the next step in this process is a peer support training as well, because we want to make peer support as consistent, as persistent in homeless service delivery as it is in the mental health community, in the legal community, and also in the substance abuse community. It works. My program in Orlando, where we house the 300 hardest to serve people on the streets of Orlando, some of those people had been on the streets for 30 years. We housed all 300 of them, and after 2 years, they were all still in their housing. Wow. And the most important component in that program wasn't case management, wasn't substance abuse treatment, it was peer support. Yeah. And so we need to make that something that happens in every community. So I'm going to stop now and give it to David.
Okay, thank you. I was invited to work on this project about 6 months ago. It's in December of 2021. And the idea at first seemed fairly exciting. Not particularly novel, getting people with lived experience of homelessness into positions, but the exciting part of it is actually training them, putting together a curriculum and content to train people with lived experience of homelessness to take leadership positions, to take positions on the boards of your COCs, to take positions in committees of your city commission, of your county commission. Okay, so this is a way that we're going to end homelessness, by infiltrating. It's sort of like an inside strategy. Okay, coming from the inside, occupying these leadership positions, and then actually influencing public policy. That is an amazing, exciting proposition, and I got to say, I got to give Don all the credit. This has been his baby. He has birthed this. he has thought about this and developed this idea over years. And it's an absolutely incredible and I believe revolutionary idea. So I'm very excited about working with this. When we came in December, one of the leaders that was developing the project is now the director of the U.S. Interagency Council on Homelessness, and that's Jeff Olivet. And so Rajni and I took over after Jeff got appointed. to be the leader of that major organization, of the major government agency. And so the two of us are doing the job that he alone was doing. So that's just a little background here. Donald presented a sample, a teaser of one of the modules. We have somewhere, I guess, between 9 to 12 core modules of core topics. The most important, I think, being communication. Because everything starts with communication, obviously. If you're not communicating, you get nowhere. Okay? The other module that I'm going to present here to give you a sampler of is a Know Your Rights module that really has two components to it. One is to let you know what your basic rights are, and two is to talk about the flip side of that, cities and localities' efforts to criminalize homelessness. Okay? To take your rights away from you, essentially. And we believe that these are two of the most important modules because anybody who's going to be in a leadership position obviously has to know how to communicate. And anybody who's going to be in a leadership position in terms of ending homelessness has to know the basic framework, the groundwork, the context of what your rights are. So, our modules are always going to start off with a pre-assessment, which is going to be basically asking some questions here. And we can go through this right now real quick. Homeless rights. Okay, so this is a pre-assessment. Fresh off. The first thing that you click on when you do our modules, when you hear our module. And I'll ask this question. Can police arrest you for sleeping in public spaces if shelter is not available? Does anybody have an idea on that? Yes, go ahead.
Some areas.
So I would like to say, no, they can't arrest you. But I've been privy to where, in certain circumstances, people have been.
Okay, we're just going to take three because we're just going to go through this real quick here. I'm just going to take two others, and I'm not going to tell you what the answer is. This is just a pre-assessment. This is just a pre-assessment. So we're going to take two others. Go ahead.
It depends on your local government's laws and regulations regarding that specifics.
You say yes, is that right?
I mean,
Or you say no, and you say it depends.
Depends
Well, I
on your
say
local,
no,
because
but
I've
I've seen
seen
it
that their
happen.
own.
We're going to take just one more, okay? And because we have several other pre-assessment questions that we're going to go through. Go ahead, Amanda.
Yes, police can arrest you for anything at any time. No matter if, can you be convicted for? And that answer, can you be convicted for sleeping in public spaces, is a yes.
They got the guns, they got the handcuffs, they can do anything they want. Okay, next pre-assessment question. Do you have a right to ask a stranger for money? We're going to take three. I'm just going to randomly. Anybody raise your hand? Okay, what do you think?
I'm gonna say yes.
Okay, you say yes. What do you
I
think?
say the same thing.
You're going to say yes. What do you think?
Yes.
Okay, yes. So you have a right to ask a stranger for money, even when the guy with the gun and the handcuff says you shouldn't. Okay.
Yeah.
Okay. Next pre-assessment. Do you have a right to sit or stand in public places over long periods of time?
No.
Yes.
Okay. Three. Paul, what do you say?
Yes.
Yes. Okay. And what do
No.
you? No. All right. Do you have a contrary opinion? What do you say?
I would say yes if you're in a public space and you're not blocking transgress.
Okay. You guys keep these things in mind now. Okay. These are all just pre-assessment. These are simply questions. We're not giving answers right now. We'll get the answers as we move forward. So, I want a real quick definition here. And I'm only going to take two. All right? A real quick definition. What does it mean to criminalize homelessness? Yes.
All of those three on the left.
Okay. What do you say?
Laws specifically targeting a specific group of so homeless people or places that they are that would not be affecting those that are not in opposition.
You're cheating. You must have studied this before. Okay. All right. I'm going to take two on this one. What are some of the things that cities are doing to criminalize homelessness? I'm not going to ask you because you obviously don't think. What are some of the things that cities are doing?
In Tennessee, it's a felony up to 6 years in prison if you're caught sleeping in public places.
That's right.
Okay.
It starts tomorrow.
And I'm going to take one more.
Can be bad.
Camping bans, excellent, that's a good one, okay. And last pre-assessment question here, and this is a very important one, by the way, and I'll explain why this last one is very important. What are some alternatives to criminalization? I'm going to take 3 on this. What are some alternatives?
To have your state write up a homeless, Massachusetts is trying to write up and get it passed with the state law. It's called Bill of Rights for homeless people. And they have been trying to pass it through the state for like 3 years now.
Okay, Bill of Rights. Let me take 2 more. What are some of the alternatives to criminalization? Hugo.
Outreach and housing.
Outreach and housing, that's great. 1 more. What are some alternatives to criminalization? Okay, we're gonna
People the hell alone.
leave people the hell alone. It may not be an alternative though. That's the reason why they're criminalizing, because people are being left alone. Okay, so let's go into the key concepts here. By the way, these are scenes from Miami. Key concept, criminalization. That's obviously going to be a key concept. And so by the end of even this teaser, I'm skimming over the module. Everybody in here should understand what criminalization means. Another concept, encampment sweeps. Because people need to know what that means.
Yeah.
Coming up to somebody and grabbing their tent, it's not necessarily a sweep. But when you come through with 20 police cars blocking off the sidewalks,
Bulldozers.
the water tank trucks, the big claw thing that comes down and grabs your tent and tosses it in the dump truck, I think that would fit within the definition of a sweep. And I hope you'll agree with me by the end of this. We'll take questions in just a moment. Okay, I just want to go through the concepts. Sorry, I apologize. but keep in mind your questions, because we're going to have some questions here. Uh-oh. Mr. Technician. Oh, I'm sorry. My fault.
You're good.
My fault. I was messing up. Okay, here's an important concept here. Life-sustaining activities. That's going to be a core concept that everyone needs to understand what that means. Life-sustaining activities. Because that is essential to determining where your rights spring from and what your status is of somebody experiencing homelessness. Life-sustaining activities. That is a very key concept. And then the other key concept will be, what are your constitutional rights? And we're not going to get too much detailed into that. We're not going to get too much into the weeds. You will need to know at least about 3 amendments. The First Amendment, the right to freedom of association, the right to freedom of religion, the right to freedom of expression. You are going to have to know a bit about your Fourth Amendment, right to be free from unreasonable search and seizure. Okay? And a little bit about the Eighth Amendment, which is the prohibition against cruel and unusual punishment. So these are the key concepts in this particular module. So just keep this in mind.
And
Now,
there's
let me go-
8 modules or 6? 6
We're
modules?
still kind of
you're still
refining
working.
it. We have certain core concepts that we're building the modules around. So we have the core concepts, and we're kind of like cutting and pasting and trimming the modules. So
And that has to be done today, so.
that's has to be done yesterday. We actually have a very important call coming up with a funder in a couple of hours. So this is going to be the content section. And I'm probably way over time, so we're going to just
No,
going
you're
to.
fine, you're fine.
I'm fine? Okay, so we're just going to zip through the content section real quick, where we're going to come up with answers to some of the questions of the pre-assessment and the key concepts. So, real quick summary here. As Don said, it's important to know your history, or else you're condemned to repeat it. This whole homeless rights, really started about 30 years ago. Actually started in my neighborhood in Miami with a key case called the Pottinger case. Anybody ever heard of Pottinger? Raise your hand if you ever heard of Pottinger. Okay? You know it because that's in our neighborhood. All right? That was a key case. The first time in federal, in court history, in legal history, that a lawsuit was actually bought on behalf of people experiencing homelessness to protest, to combat the city's summary arrests of people experiencing homelessness and destruction of their property. And so it was bought by this individual called Michael Pottinger. It was a class action. Miami was just out of control. They were taking people's possessions, piling up into a big pile in a park and setting them on fire.
Really?
Okay? They were throwing people's stuff into the river. There were something like 7,000 arrests of the homeless within a 3-month period.
Wow.
If you can believe that. It was absolutely insane. So make a long story short, because it is an extremely long story, this lawsuit was first bought in the early 1980s. People thought it had absolutely no chance in hell of it going anywhere. Luckily, we happened to get a judge who was real strong on civil rights, and this set a monumental landmark case law. But basically, as I said, we're speeding this way up, leaving a whole lot of details out. What Pottinger, the city of Miami fought this for about 15 years and finally settled in the mid-1990s, paid $1 million in attorney's fees, and established certain legal principles. Go back to your pre-assessment here. What rights do you have against arrest when you're sleeping in public? Pottinger set the principle here that police cannot arrest you for the status of being homeless. That's an important thing, status of being homeless. Just like the status of being black, the status of being Jewish. They cannot arrest you for the status of being homeless, sleeping in public, or conducting life-sustaining activities in public if shelter is not available. They cannot do that.
Is that only good in Florida, or?
We'll get to the jurisdiction in just a moment. I just want to talk about the principle right now. Okay, because that principle is actually relevant to today. This was established in the early 1990s, but it's also relevant today. And it's also law in certain areas of the country, which I'll get into in just a moment. Okay, but I just want to get to this important principle right here. 3 minutes? Wow, okay. So Pottinger established that principle that police cannot arrest individuals for the status of being homeless unless shelter is not available. That principle is now law in the western states because of a case called Martin v. Boise. That is law in what's known as the Ninth Circuit. And these are California, Oregon, Washington, Arizona, I believe, Utah, Nevada. Wow. So that is the law in those western states. Now that law is not always adhered to, and we can go into those exceptions, but that is the law. And that is just a general precedential principle in other areas of the United States. So, right to share food. That's a First Amendment right, okay? The right to freedom of association, the right of charities to express their religious, their spiritual expression by sharing food with the poor, with the vulnerable, with the homeless. That's a First Amendment right. You have property rights too, against unreasonable search and seizure. If you have your property sitting there and you're surrounded and it's not contaminated, and it's obviously not a physical threat to the safety or contaminated, you have the right against unreasonable search and seizure and police destroying your property. And panhandling, as people here know, is also a First Amendment right of freedom of expression. So let's talk about current trends real quick. Cities don't care, okay? They have enacted nationwide bans on sleeping in public. That's a current trend. The knee-jerk reaction is to criminalize homelessness, is to go after the folks who are sleeping in public and ban them from doing that. At the same time, there is a right-wing think tank that has coupled these laws against bans and sleeping in public with designating an area where you can sleep in public. We don't like those because we believe that people who are homeless have the right to be anywhere and everywhere that they want to be in public spaces. We shouldn't be relegated to some homelessness ghetto or banished to some permitted encampment space. And as I said before, cities are currently engaging in cabinet sweeps. So why is criminalization bad? Okay? It's expensive. Far more expensive than giving a person a home. In Miami, they dedicated a police unit called the Heat Unit. They're paying $70,000 a month to this police unit to just go around and harass and traumatize the homeless. $70,000 a month, $800,000 a year, nearly $1 million a year just to get the police, instead of protecting the public against crime and criminals, to harass the homeless. Isn't that ridiculous? That's crazy, okay? It worsens homelessness. When you traumatize people by scattering them around, you make it harder for them to escape the cycle of homelessness. It gives people criminal records. That poses problems when it comes to trying to get into public housing. That poses problems when people try to get employment. Okay? So this is just a way, basically criminalization is an expensive way to make homelessness worse. You're paying more money to worsen the problem.
That's the intention.
Okay? And finally, and this is really a fairly important thing here, it breaks the connections with healthcare providers and services. There's actually models out there, medical models, that show that after encampment suites, overdoses go up. Deaths actually go up. They actually have a model to show that for every encampment suite that's X number of people, you can expect within a year, X number of people to die. So this is no joke, folks. This is a matter of life and death. Okay. So that's real quick, because I'm almost over. I'm way over. Okay. It's important to talk, and we're not going to get into this real deep here, but you can't just complain about a problem and say, I've got rights. You can't just do that, okay? Because there's a reason why they criminalize homelessness. They want to promote public health, public safety. They have legitimate reasons, okay? They also have illegitimate reasons, but the legitimate reasons are to promote public health, public safety, not have all these unsightly tents in front of your house. There are legitimate reasons. And so we can't just complain about a problem without offering a solution to that problem. So it's not enough. Whenever you're in a public forum and debating this and saying that I have rights, you also have to propose the alternative to police coming out and cleaning the encampment up. So it's very important for you to know. You got to connect the two together, because folks are going to say, well, if we can't arrest you and kick you out, what are you supposed to do? Let our neighborhood go to hell? Like, no. The solution to homelessness is what? Homes. Okay? So we have alternatives. We'll go into details of this later. Housing first, that's a huge alternative. Other permanent supportive housing, and using hotels as bridge shelter. Okay? So that's a 20-minute summary of an hour and a half module.